Hi, my name is Toby Hall. I'd like to give you some information about manual concepts, and we'd also like to give you some more information about some of the programs that we've run. People have asked us many questions about the different programs, so we thought we'd just give you a little bit more information about each of the courses. Manual Concepts was formed in 1993. We ran our first course on the lumbar spine with Professor Peter O'Sullivan, but since then we've been running many courses in many different countries. I think now even 35 countries around the world, with many different types of courses, from short seminars to courses over 2 days to even a 4-week program which forms part of the master's course at Curtin University.
Yeah, so one of our flagship courses is our CSMT, which is our Certificate in Spinal Manual Therapy program. This has been run for many years, both in Australia and overseas. It's a fairly intensive 8-day program where we look at manual therapy from various concepts, including the Maitland concept, Mulligan, the neural tissue assessment and treatment approach, so that we're looking at a more holistic view to the use of manual therapy and the appropriate use of manual therapy when treating spinal conditions. The course has always been extremely popular with our course participants, to the point where people feel reinvigorated and really enthusiastic about going back to their clinical practice to treat their patients.
Yeah. A high percentage of the course is practical. We really encourage the development of clinical skills in assessment and treatment, so these take time to practice.
And if I could just add, Kim, from what you mentioned, just yesterday I got back from Dublin, where I was teaching a 8-day CSMT course, and I think what people were most happy about the course is that we not only discuss the latest and best practice, but also give them a clear understanding how to assess different types of musculoskeletal disorders. So how do we know that this patient might benefit from manual therapy, which patient may benefit from motor control exercises, which patient may need some neural tissue type of treatment for that particular disorder. And the key thing, I think, in our courses, what we teach is really not only the techniques, but really how to do a good assessment, how to come up with a good provisional diagnosis and apply the particular treatment for the patients.
Yeah, I think that's really important. Like, some people do have the impression that when we use manual therapy, it's used in isolation. But in the modern way of applying manual therapy is just part of the overall assessment, evaluation and treatment process. So manual therapy can be easily integrated with exercise therapy, with some pain science education, together with other management strategies to give the patient the best possible result.
So the Certificate in Orthopaedic Manual Therapy is a 4-week program which aims to really bring people up to the most recent level of evidence and practice, how to manage people with musculoskeletal disorders, from acute pain to chronic pain, from people with severe neural disorders, motor control problems, articular dysfunction, through to management of complex chronic pain using a wide range of different approaches.
Yes, we're really lucky. Manual Concepts has a fantastic faculty, and the people who provide teaching for us are highly qualified, highly experienced, and highly respected on the world stage of manual therapy and musculoskeletal physiotherapy. So we're extremely lucky to have people of that ilk teaching for us on our program.
And we have participants coming from all over the world who want to really update their skills, perhaps also join a master's program, and you can use this course as part of a master's course at Curtin University or at La Trobe University in Melbourne or various other universities around the world.
And I think the reason why I think CMT is such a unique course is because we have guest speakers and experts that we invite on our course.